So good morning and welcome. I'm Kelly Parsons. I'm the CEO of WaterAid America, and it is such a pleasure to be here today to moderate the first event of the Congressional International Water and Sanitation Caucus. I know we've still got folks logging on, and so I'm going to hit a couple of housekeeping points, and then we'll get started because we have a really full agenda. I want to thank the fellow co-chairing organizations of the Interaction WASH Working Group, as well as the members of Congress and their staff who've joined us today for pulling together such a wonderful event. I'm excited to see the number of people who are interested in this virtual event and this critical topic. I believe we're expecting something on the lines of 500 participants today, so a great launch event. Now, I have a few housekeeping points before we get started. This is a webinar style event, so attendees will remain muted and videos will be off. As we know, no webinar platform is perfect. We've got a lot of different organizations logging in. We each have our own protocols. So again, thank you very much for your patience as we work through any issues that may emerge. You can submit questions for the panelists through the Q&A chat function there on the right-hand side of your screen. Please, when you do so, share your name and organization along with your question, both so that we can follow up and we can give the speaker that context. We will try to incorporate questions into the panel to the extent that time allows, but if we don't, we'll be happy to share your questions with the panelists after the event. These questions will also help us to shape future events like this. And finally, please note that this event is being recorded and is open to the press. See, the event recording will be shared with participants following the event, and everyone can get access to that. So with that, let's get started. Context for this, as all of us have become accustomed to the reminders to wash our hands, 40 seconds, 20 seconds, longer than you necessarily think or is natural. And as our country continues to grapple with the spread of COVID-19, we are often overlook the reality that 40% of the world's population cannot wash their hands at home. What has become an area of tremendous focus in our own everyday lives, in our families, in our workplaces, remains completely out of reach for billions of people. Water, sanitation, and hygiene, often called WASH, are a package that's critical to development and all the development sectors. At WaterAid, we distill the scope of WASH in our tagline: clean water, decent toilets, and good hygiene. But WASH is more than just one package of actions. WASH affects and is part of every sector. Without WASH, we cannot achieve U.S. global health and development commitments, including increasing girls' education, ending preventative maternal and child death, security, economic growth, and women's economic empowerment, democracy and governance, our own national security. All of these issues are intricately interwoven around WASH. These are the reasons why WASH has long been a bipartisan issue, and Congress has supported many decades of support for WASH and WASH initiatives. The Congressional International Water and Sanitation Caucus is an opportunity to galvanize this support and collectively learn and think about WASH policy solutions that can save lives. We have a great program today featuring remarks from the Caucus Co-Chairs, remarks from USAID and GAP, and a panel discussion on the important role of WASH in the COVID-19 response. With that, I'm going to turn over to our congressional speakers. I know I speak for the WASH community when I say thank you so much for your championship on these critical issues. We're thrilled to see this caucus coming to life and the turnout that we have today. So to introduce our first congressional speaker, Representative Blumenauer, a longtime champion of global WASH issues and author of the Water for the World Act. I'd like to thank the Congressman for spearheading this caucus. Congressman, over to you.
Thank you very much. I am joining you from Portland, Oregon, where we're dealing with horrific consequences of the wildfire, but there's no way that I wanted to miss this conversation. And thank you, Kelly. Appreciate the introduction. This is a moment I've been waiting for a long time. I could not be more excited about now having a bipartisan water caucus with my friends, Darin, Jackie, having social people who understand the issue, who care about it, who are respected, and can provide the focus and insight to help us build on this momentum. We have had tremendous success in the past advancing this on a nonpartisan basis. At times it hasn't been the easiest thing to do, but we've had the opportunities helping people understand that this is truly an existential challenge globally to the world. Nobody is more than about 36 hours away from being infected by some sort of disease that is a result of inadequate sanitation or drinking water. This is a challenge for women of the world. Today, there will be 160 million hours that will be wasted away from education and economic activity as women around the globe try and get water, often unhealthy water, for their families. We have an opportunity to help people understand the reality of these issues. We toss off statistics that somehow 1.5 billion people have safe drinking water, or 4.5 billion do not have adequate sanitation. The numbers are overwhelming. But this is an area where the United States can provide leadership, can do so in a way that's cost effective, that brings people together at a time when there is so much division and upset, and people are dealing with challenges around the globe. Trust me, I feel it here in Oregon right now. People feel overwhelmed. But this is an area that we can work together to make a profound difference. Having the United States assume leadership in this global challenge is something that I'm excited about. And I think this caucus is going to help us drive these points home, build more support for something that, as I say, can bring us together at a time when people want that connection. I appreciate the chance to be with you and look forward to success later in this Congress and the next. Thank you very, very much.
Thank you, Congressman Blumenauer. I love your directness and your emphasis on the focus and insight that we need to build on this momentum in order to make that profound difference that we all so much want to see in the world. So thank you very, very much for your leadership and your remarks. Next, we're fortunate enough to have a taped remark from Representative LaHood, who's a founding member of the caucus, but was unable to join us live today. So let's turn over to those remarks, please.
Good morning. I'm Congressman Darin LaHood, and I represent the 18th District of Illinois in Congress. Welcome, everyone, to today's virtual launch event for the International Water and Sanitation Caucus. I want to thank Interaction and their staff for their coordination and efforts to make this event possible. I am honored to work with my colleagues, Representatives Blumenauer, Walorski, and Torres Small, and the Water, Sanitation, and Hygiene, or WASH, Working Group, comprised of stakeholder groups with experience and policy expertise in water and sanitation, to highlight in Congress the international freshwater and sanitation challenges that affect economic productivity, national security, and global health. Capitol Hill has a strong history of bipartisan support addressing international freshwater issues, including the passage of the Water for the World Act in 2014 and the Clean Water Act. The International Water and Sanitation Caucus will build on this legacy and continue to educate and encourage members of Congress to elevate the importance of water and sanitation in U.S. development, assistance, and diplomacy. While the global health benefits of adequate sanitation and water supply is central to the overall WASH goals, the economic benefits and national security impacts are commonly overlooked. Improving global WASH access adds over $60 billion to the world economy annually, and conversely, poor sanitation and water supply results in an estimated economic losses of $260 billion annually in developing countries. That's 1.5% of GDP. As a world trade leader, it is important that the United States engage in activities that move developing countries from aid to trade. Of the top 15 current U.S. trade partners, 11 of them previously received U.S. foreign assistance. Increasing access to clean drinking water and sanitation around the world has proven to benefit U.S. trade productivity. Additionally, inadequate water and sanitation around the world is a risk to national and global security. Research has shown that countries facing risk of war have low or no water cooperation. These inadequacies create opportunities for terrorist groups such as ISIS to gain leverage, or local governments and religious minority populations. According to the 2017 CNA Role of Water, Stress and Inability and Conflict report, water-stressed areas can be central to inciting violence, especially civil unrest, opening the door to escalation, and even government destabilization, threatening the national interests of the U.S. and its allies. I look forward to hosting and participating in future caucus events to further educate my colleagues in the Congress and their staffs on the WASH impact on national security, the economy, and trade. As we are in the midst of the COVID-19 pandemic, today's timely briefing and discussion will bring attention to the important role WASH has in prevention and eradication of the coronavirus. I would again like to thank the WASH Working Group for inviting me to speak today, and to all of our attendees. And I hope that we can continue this important conversation moving forward. Thank you.
Great. Thank you to Congressman LaHood for sharing these remarks. It's wonderful to hear the points on WASH and economic growth and WASH and security that you bring up. Next, I'm pleased to welcome Representative Torres Small. Congresswoman, please go ahead.
Thank you so much, Kelly. It's an honor to get to join all of you today. So, safe water and soap. These are the fundamental building blocks that we recognize are crucial for not only our health, but also our economic development, and also when it comes to fair opportunities for everyone. That's why I'm so deeply grateful to get to join Congressman Blumenauer, Congressman LaHood, and Congresswoman Walorski on this deeply important effort. Thank you so much to WASH for your long tenured work to make sure that people have access to those fundamental building blocks, safe water and soap, because it's crucial. Whether it's domestic, like within the Navajo Nation, which I represent, working hard to make sure that people have access to good, reliable water, which is going to be crucial as we continue to fight COVID-19, as well as we work to continue to advance our economic development in these regions. It's also crucial in places across the world, like Eswatini, where I spent my last 2 years of high school, where I learned the importance of good, reliable, safe water when it comes to an individual's health, but also when it comes to the health of a family, the health of a community. And we've seen that all the more about how that safe water and soap is crucial when it comes to fighting worldwide spread for COVID-19. That's why we have to find ways to work together to advance, to invest in infrastructure here domestically, and to make sure that people have access to that safe water abroad. So I'm so deeply grateful to get to join this caucus as we identify the challenges so that we can protect our health as well as protect our economy and grow it, because we know that water is crucial for food, for fiber, and for fuel. And that's why it's deeply concerning that around the world, almost 1 billion people do not have access to that safe water that's crucial as a basic necessity. So thank you all so much for your work today. And I'll just close with the words that my grandmother knew so well as a farm worker picking cotton just outside of the city I now call home. El agua es la vida. Water is life. Thank you so much.
Thank you, Congresswoman. What a great way to end that with the water is life emphasis. And now we have Representative Walorski. Congresswoman, have you joined?
Yeah. Are we connected?
Yes, we can hear you.
Awesome. Can you see me?
Yes, we can see you.
All right. Thanks so much. Well, I want to thank everybody for attending and helping us launch the bipartisan International Water and Sanitation Caucus. Access to clean water for drinking, sanitation, and hygiene is necessary to improve health and wellness, promote social resiliency, and strengthen the global economy. As the COVID-19 pandemic has made clear, adequate water, sanitation, and hygiene, or WASH, can help communities treat illnesses and prevent the spread of disease. Safe water infrastructure and sanitation can make the difference a community needs to foster economic empowerment and growth, because ready access to clean water allows people to focus more on time, work, energy, involvement in their education. According to the World Health Organization, rural populations worldwide are significantly more likely to lack access to clean water than their urban counterparts. My district in northern Indiana is very rural, so I understand the district and the rural settings. It takes a coordinated effort between federal, state, and local leaders to make sustainable advancement in WASH infrastructure and services. I also want to take a moment to highlight some of the important frontline work some Hoosiers in my community have done to improve clean water around the world. Students from the Pult Institute at Notre Dame provided 90 households in Columbia with biosand filters, enabling more than 150 people to access clean water. The Notre Dame Public Health Brigades installed latrines and water storage units in Honduras, and the university's Engineers Without Borders constructed a water chlorination system at a school in Ecuador. Clay United Methodist Church in South Bend, in conjunction with the Notre Dame Initiative for Global Development, funded the installation of 78 wells in rural villages in Burkina Faso. Sunset Solutions in Elkhart makes high-tech devices that monitor water pumps, which are being used in the Central African Republic and Ecuador. Finally, the Elkhart Rotary Club supported the purchase of a water truck in Zambia to drill safe and reliable water wells. These projects for my district demonstrate a commitment to service and focus on solutions that make me optimistic about our future, especially when it comes to addressing WASH-related challenges around the world. I look forward to hearing from our distinguished speakers today and working with them, as well as my colleagues, to explore ways to improve access to safe water and proper hygiene in communities across our country and around the world. Thank you so much.
Thank you, Congresswoman, and thank you, Representatives Blumenauer, LaHood, Torres Small, and Walorski, for your leadership on this important issue and for creating the caucus. I also want to thank the 8 additional members of Congress who've joined the caucus thus far: Representative Connolly, Fitzpatrick, Ming, Omar, Panetta, Reschenthaler, Vargas, and Yoho. So now I'd like to turn to our first keynote speaker. We are lucky today to be joined by Jennifer Mack, Deputy Assistant to the Administrator and Global Water Coordinator, at USAID. Jennifer, can I turn over to you?
Yes, thank you. And thank you so much, Congressman Blumenauer and LaHood and Congresswoman Torres Small and Walorski. I'm honored to be here for this exciting event today. And congratulations to the 4 of you for launching the first ever Congressional Caucus on International Water and Sanitation, and also for your commitment to ensuring it is a bipartisan effort. The caucus will be a valuable platform for ensuring the Spirit of the Water for the World Act. As we know, safe drinking water, sanitation, hygiene, and water security have enjoyed 15 years of committed bipartisan support from Congress and from many of the partners joining us today, who represent not only the WASH and water resources management, but also many of the sectors that are inextricably linked to WASH: health, humanitarian assistance, gender, and poverty reduction, among others. Even before the COVID-19 pandemic, we knew that water and sanitation demand strong leadership and attention. 1/3 of the global population lacks safe drinking water. Over half of the global population lacks safe sanitation. And by 2025, nearly 2/3 of the global population may face water scarcity. A national intelligence estimate on water concludes that water challenges such as droughts, poor water quality, and floods will increase the risk of instability and state failure, exacerbate regional tensions, and distract countries from working with the United States on important policy objectives. Our collective investments in water and sanitation address these challenges and also contribute to a healthier, safer, and more prosperous world. For example, improved water services give women and girls their time back, enabling them to work and go to school. Water drives job creation and economic growth. In fact, estimates show that 3 out of every 4 jobs worldwide are linked to water. And the return on investment for WASH, both at a national and global level, is enormous, with as much as $4 return for every dollar invested. The pandemic has brought into stark relief the urgency of better water and sanitation around the world. We've seen how it is critical not just to preventing the spread of COVID-19, but for safely reopening economies as well. Even so, the pandemic is exacerbating pre-existing challenges faced in the WASH sector. Hand washing is difficult, and if not impossible, for billions due to a pre-existing lack of access to piped water across Africa, Asia, and Latin America. As we know, absent a vaccine, hand washing alongside social distancing is our first line defense against COVID-19. So, proper hand washing is critical to curbing the pandemic in some areas, preventing a second wave in others, and ultimately, as I said previously, to reopening economies. As so many of us know, another great challenge is water and sanitation in health facilities. Too many health facilities have low levels of water and sanitation due to poor coordination among ministries of health, water, and sanitation, putting healthcare workers and their patients at risk of not only COVID-19, but of other infectious diseases too. We can and will do better. Perhaps the greatest challenge we are facing, though, is the imminent risk of utility failure, especially in small cities and towns, where loss of revenue and payment due to COVID-19 are compounding existing challenges with governance and financial management among water and sanitation service providers. To put a finer point on this, if utilities fail, water stops flowing and sanitation services cease. And that impacts everything we've been working toward. It means communities, households, health facilities, schools, and businesses cannot access safe water. Intervention is critical. So COVID-19 has certainly proven something we already knew to be true. WASH is undeniably a central part of building household, community, and national resilience to crises and to helping countries achieve self-reliance. USAID is not only addressing the short-term challenges, though, we are also proactively planning for the post-COVID world in a process we're calling Over the Horizon. Across the agency, WASH continues to be highlighted as one of the most important sectors for investment, both to help prevent the next pandemic and to address the devastating impacts we know this pandemic is having on households and communities. Around the world, economies will not be able to safely reopen without WASH, and adults won't be able to get back to work, nor children back to school. Building on 15+ years of support through the Water for the Poor and the Water for the World Acts, we look forward to continuing to work with Congress and the newly formed caucus to ensure we are building a more resilient future for WASH as nations recover from the impacts of COVID-19. Thank you.
Thank you, Coordinator Mack, for your remarks and for you and the team's leadership at USAID. Now I'd like to share a little bit from the field. Let's shift our focus internationally. We have a short video from Haiti showing some of the important water and sanitation work that is occurring there, led by DAI.
Haiti is struggling to meet the Sustainable Development Goal of providing clean water and sanitation for all by 2030. Right now, only a small percentage of urban households receive treated water through the pipe water system. To change this situation, USAID is providing $42 million through its water and sanitation project with 3 goals. Helping 250,000 people get improved access to water, helping 75,000 people get improved access to sanitation. Working with the Haitian government so that the changes introduced through the project lead to sustainable increases in access to water and sanitation across all of Haiti. The project is reaching this goal by helping the local water and sanitation utilities to think and act like a business, to focus on the customer and increasing their revenues. Intervention includes improving the management of the pumping and spring-fed water system so that more water gets into the system, repairing pipes, disconnecting non-paying customers and focusing on reducing other non-revenue water losses so that more water is used, helping the utilities to develop an accurate computerized database of their customers to issue timely invoices and to accept mobile payment. As a result of this intervention, all of the targeted utilities are already providing more water more often and to more customers. 5 of the 7 targeted utilities have significantly increased their revenues and collected on arrears. People pay for better service. The project is on track to meet its goal and to put Haiti on the path toward sustainable increases in water and sanitation.
Great to see work that's building WASH capacity in Haiti. I'd now like to turn things over for remarks from Lisa Hook, Women and Water Program Manager of Sustainable Innovation at GAP Incorporated. GAP is a partner to many, including USAID and WaterAid, and we're pleased to share these taped remarks with the caucus.
Good morning. My name is Lisa Hook with GAP Inc., and it is an honor to be with you today. I sit on GAP Inc.'s environmental sustainability team and serve as the chief of party for the USAID and GAP Inc. Women and Water Alliance. Now you may be wondering, what does GAP Inc. have to do with women and water? Well, the reality is that the apparel industry contributes to about 20% of global freshwater pollution. And many apparel producing countries face significant water stress. We estimate that it takes about 1,000 gallons of water to produce 1 pair of jeans. And this reality is not just one for our product manufacturing, but it's a reality for the women and communities where product is made. Globally, women make up 80% of garment workers, and in many of these countries, women face a disproportionate burden to accessing clean, safe, water and sanitation resources that are critical to their health and the health of their families and communities. We believe water is a human right and are committed to advancing WASH outcomes for the women and communities touched by our business. That's why we're partnering with USAID on a 5-year global development alliance, the Women and Water Alliance, with the aim of improving and sustaining the health and well-being of women and communities touched by the apparel industry in India through improved WASH services. We're proud to work with our longstanding partner WaterAid, as well as CARE, Water.org, and the Institute for Sustainable Communities. Unique to our approach is that we're placing women at the center of WASH solutions. We're catalyzing women in cotton growing and textile manufacturing communities to be champions for their WASH needs. Through this partnership, we're bringing best practices from both public and private sectors and leveraging our collective strength, assets, resources, and influence to advance WASH outcomes. Now, more than ever, especially in the face of the COVID-19 pandemic, investment and partnerships in WASH are critical to the resilience of our communities and our business. Thank you.
Thank you. Fantastic to hear how WASH impacts sometimes the less than obvious industries and to hear about the great work that GAP is doing. Before we turn to our panel discussion, we have a final video. This is coming from Millennium Water Alliance and the Kenya Rapid Project that builds on the importance of public and private partnerships in WASH.
In Kenya, Millennium Water Alliance is leading a 5-year, $35.5 million program called Kenya Resilient Arid Lands Partnership for Integrated Development, coined Kenya Rapid, which is, according to USAID, a global development alliance, or in Kenya, what we call public-private partnerships, that brings the USAID, the Swiss Development Corporation, private sector partners, MWA members like CARE, Catholic Relief Services, World Vision, and Food for the Hungry, convince, under the leadership of Millennium Water Alliance, in the arid lands counties in northern Kenya. The program actually combines the assets and the experiences of development actors and private and public institutions at county and national level by leveraging their capital and investments, innovations, and access to market to address the complex problems in the water, sanitation, and hygiene sector that actually culminates in inadequate water access and poor governance of natural resources in the arid and semi-arid lands. Now, throughout these 5 years, we have worked with these communities to build their capacities towards journey to self-reliance. And so far, we have reached over 460,000 people, actually having surpassed the target of 450,000 people. We will together, as we look towards the next steps for Kenya Rapid, we want to ensure that we scale up the private sector models that have worked. We use market systems and we build the capacity of the local governments at national level and the county level to be able to drive their own national agenda.
Fantastic. Thank you, Coordinator Mack, Lisa, DAI, and MWA for these remarks and wonderful videos. We'll turn now to our panelists for a bit of a fireside chat. Looks like we have about 25 minutes for this, and we're going to be discussing WASH and the impact on COVID-19, the interactions there, and what we know so far. WASH is more important than ever during this pandemic, and we're going to hear about that from the front lines of this work. So first, I'd like to introduce Kellyanne Naylor. She is Associate Director for the WASH Section Program Division at UNICEF. And Kellyanne has over 19 years of experience in the WASH sector, managing urban, peri-urban, Central Africa, South Asia, Latin America, the Caribbean, and North America. It's just about everywhere, I think. So Kellyanne, welcome. We're also pleased to have Carrie Hessler-Radlett, President and CEO of Project Concern International, a global communities partner. Project Concern International is a global development organization working to enhance health, end hunger, and overcome hardship in 16 countries. So I'd like to turn to each of you panelists and offer you the space to share a little bit about WASH within your organization and how you're approaching your WASH work. Kellyanne, can I ask you to start with a few comments?
Great. Thank you so much, honorable representatives and colleagues. Thanks very much for this opportunity. And I think, of course, we're here today talking about COVID-19, but so many humanitarian and development challenges, water, sanitation, and hygiene are the solutions. So coming from UNICEF, which is, of course, the United Nations Children's Agency, which is one of the leading UN agencies working on water and sanitation and hygiene responses in both humanitarian and development settings. And so before COVID, we had programming in over 100 countries, and that's now gone up to around 125 countries with the response to COVID-19. So our response to COVID is really built on two pillars. The first being, of course, the public health epidemic response, and the second being the continuity of basic services that children rely on for survival. WASH has been very much on the front lines of this response, and we have 3 pillars in our global program. First and foremost is hygiene, which is really looking at how we can break the barriers in the human-to-human transmission through the promotion of hand washing with soap and water. The second pillar of our response is what we call infection prevention and control. And this component of the response looks at breaking all of the different pathways of transmission of infections, whether it's in a setting in a healthcare facility, in a school, in a community, in a workplace. We look at putting in place the measures for both personal practices, but also the necessary facilities, protocols on cleaning and disinfection. And the third component of our response, as I mentioned, centers around ensuring the continuity and affordability of essential wash services and products, because we know it's not only been the impact of the public health epidemic, but also the different measures that have been put in place that are impacting markets, that are impacting water utilities to be able to provide services at a continuous and affordable price. So thus far in the response, UNICEF has reached almost 64 million people with basic water and sanitation supplies. We've trained over 3 million healthcare workers on infection prevention control, and we've reached 2.7 billion people with hygiene messages. We've also worked together with the World Health Organization to launch a global partnership with 10 other organizations called Hand Hygiene for All, which looks at using a whole of society approach to activate both the public as well as the private sector to be able to put in place hand hygiene in all settings. So these have been some of the key cornerstones of our response thus far. And we really would like to thank the US government, not only for the financial support, but also the technical support. We work very closely with USAID, with CDC, and we've really appreciated being able to work together on this global response. Thank you.
Fantastic. Thank you, Kellyanne. Now I'd like to turn over to Carrie for quick remarks, please.
Thank you so much for having me. It's really great to be with you today. And I want to give a special thank you to chairs for organizing this new caucus to support the critical need for water, sanitation, and hygiene during the COVID pandemic, and for your support for strong U.S. investment in WASH programs. I am really particularly grateful to the 4 members of Congress who are sponsoring this event, Congressman Earl Blumenauer, especially for your leadership of the Water for the World Act, Congressman Darin LaHood for your recognition of the important role of water in ensuring global cooperation and stability, and your leadership and support for U.S. water infrastructure projects, Congresswoman Xochitl Torres Small for your commitment to U.S.-Mexico border water access issues, and Congresswoman Jackie Walorski for your commitment to water as a key issue in the Israeli and Palestinian talks and many other places. I'm also so very glad to be here with our friends from GAP Inc. PCI and GAP have partnered for many, many years to provide vital life skills training to women in Guatemala, Nicaragua, and India on issues related to economic development, healthy hygiene, and sanitation. And it is always a privilege to be with UNICEF, which is such a great partner and leader in so many things. As CEO of PCI, Project Concerns, a global communities partner, and president of Global Communities, we recently merged. I see every day how the pandemic has increased the importance of our WASH programming. Access to clean water and appropriate sanitation facilities, adequate hygiene are a major factor in improving health. And conversely, the lack of access to clean water, sanitation, and hygiene is a significant contributor to disease and illness of all kinds, including COVID-19. Therefore, with the onset of coronavirus, we have interventions across all of our programs, regardless of their content. So for example, if we have a health program, we now include a WASH component. If we have an economic growth program, we now include a WASH component. If we have a food security program, it includes WASH. WASH is central to an effective response to COVID. In some places, we have new programs to combat COVID-19, and in other places, we've rapidly pivoted to adapt projects to fit the new reality of COVID on the ground. To do this, we rely on the quick thinking and strong support of our partners and our funders, including the US government that has been really adaptive in this pandemic. As an example, in global communities is expanding WASH work with the help of USAID and the government of Ghana to improve sanitation and hygiene in healthcare facilities. So just imagine, people go to the hospital to receive care. Nobody ever goes to the hospital intending to get sick. And yet hundreds of millions of people around the world face increased risk of infection by seeking care in health facilities that lack even basic access to water, sanitation, and adequate hygiene. Even soap is not present in many of our health facilities around the world. So our new program in Ghana seeks to limit illness and death from COVID and other infectious diseases through support for WASH programming in priority health facilities. Investing in basic public health infrastructure, including water and sanitation systems, is one of the most cost-effective strategies for increasing pandemic preparedness, especially where resources are limited. Another example, on the other side of the world, in partnership with USAID's Bureau for Humanitarian Assistance, we're working across global communities programs in Honduras and PCI's programs in Guatemala, just across the border, to control the spread of coronavirus in hard-hit areas through education, delivery of hand washing and disinfection kits, and building public support for better contact tracing and prevention. One thing that's remarkable about this work is the scale, and I would say especially the speed of that scale. In just a matter of months, because of the commitment of the US government and the implementing partners and the host governments, PCI and global communities and local communities have shared information on the importance of hand washing with soap and water with millions of children and adults. We have rehabilitated water points, we have distributed soap and masks, and provided education on the spread of COVID-19 and where to go for treatment if community members develop symptoms. The crisis requires all of us to pull together, and that's why it's really such a pleasure to see such a wide range of partners and supporters and stakeholders from across government and private sector and the nonprofit sector here today in support of the new bipartisan Congressional WASH Caucus. This is the kind of coalition we need when facing a challenge as widespread and devastating as COVID. Strong water, sanitation, and hygiene programs are key to stopping COVID. So I just really want to thank you for your support for increased funding and attention to the importance of WASH as a critical part of our global leadership and our global COVID response.
Thank you, Carrie, for highlighting some of the scaled adaptations led by PCI and global communities. I agree that the range of partnerships that you talk about are exciting and key to this work, and especially in light of the global challenges that we face today. So as we move forward, I'd like to dig into this conversation a little more and get your perspective on a few questions. I know for WaterAid, COVID has demanded a different in kind approach to our work, especially as donor countries are not necessarily prioritizing WASH in their COVID response. For example, we've had to be more flexible, balancing containment efforts with our desires to get out there and do the work against the hardships of hunger and lack of income that many face during the lockdown. We've all mentioned several times the difficulties faced by utility providers, and so support and rallying around those market-based solutions has been critical in this time. And most importantly, perhaps, we're eagerly looking ahead to the long-term response, one where WASH is a driver of economic recovery, and we're able to emerge from this with better, stronger WASH systems, including the short-term gains. And so I'll turn over to Kellyanne first. Kellyanne, I'd love to hear what has been the biggest impact of COVID-19 on UNICEF's WASH programming, and where do you see the greatest gaps remaining in COVID response and recovery?
Hey, thanks very much, Kelly. I think really first and foremost, this public health crisis has come on top of a WASH development crisis. And one of the things that UNICEF contributes is data. And UNICEF and the World Health Organization have a program called the Joint Monitoring Program, which really looks and monitors the global situation of water and sanitation. So we've been coming out with a number of estimates looking at different dimensions of the problem. So I think on many of our minds is our schools. And so we've recently looked at how pre-COVID, 50% of schools lacked basic water and sanitation services. And in the 60 countries that have the highest risk of COVID, 3 out of 4 lacked basic hand washing before COVID. If we turn to healthcare facilities, we have a similar report. We're going to be updating it in December, where we found that 1 out of 4 healthcare facilities worldwide doesn't have basic water services. So when we've looked at putting in place responses to COVID-19, when you start that response without having these basic water and sanitation and hygiene facilities, services, and practices in place, it puts you in a very significant challenge to be able to bring children back to school safely, to be able to treat patients without having hospital-based transmission of infections, to keep health workers safe. And also now that we really look at the economic reopening, it's shed a much greater light on the poor situation of WASH in workplaces. I think the second issue that's of great concern is backsliding. And I think we've made tremendous gains as a sector over these last 20 years that UNICEF and WHO have been monitoring the situation of water and sanitation. And we do see with the socioeconomic effects that we are seeing impacts on utilities. We've also been closely tracking the price of soap and other global economy commodities related to cleaning and disinfection. And we are seeing price fluctuations, and in countries, for example, like Chad, where the income level is very low for a large portion of the population, we're seeing increases in the price of soap of up to 38%. So these are some of the trends that we think are very challenging and really put at risk some of the gains that we've made. I think just maybe a final point is just also really profoundly understanding the linkage between water and sanitation and hygiene, which we focus on as drinking water, sanitation and hygiene practices, but also linking it to some of these bigger dimensions of water resources management, and coupled with areas that are experiencing water scarcity, areas that had pre-existing humanitarian crises. We're seeing a greater increase in food insecurity, migration, and also emerging concerns about conflict, particularly intercommunity conflict, as these other dimensions around the use of water are threatened with some of the impacts of COVID-19 and these socioeconomic impacts. So these are some of the trends that we're seeing, and certainly as this is not the first or the last pandemic, we really think that it's time that we must come together to see the solution that WASH can provide for many of these bigger global trends around food, nutrition, and education. Thanks, Kelly.
Thank you, Kellyanne. I love the emphasis on the risk that we face, that the gains that we've made are at risk, and the backsliding that you mentioned. It's so true, and we need to both work forward and watch what's happened in the past to make sure we solidify those. So thank you. Now I'll turn back to Carrie. Carrie would love to hear what lessons PCI and global communities have learned from your initial response efforts. And in particular, how do you think that these lessons can be applied in the long term?
And thanks. Right away, we learned the importance of partnership and building from where we already have presence and strength. In our experience, every program can become a COVID education opportunity if we're smart and strategic. So by starting with our current projects and existing partners, we were able to move quickly to get a few things in place. And then as both and the awareness grew, we saw additional opportunities and additional funding come online so that new programming could start. This really created opportunities to expand work in areas where PCI and global communities already had a physical presence, where we had strong technical skills and deep relationships with the local communities. And I think that's especially important. And there are examples in Ghana and Honduras that I mentioned earlier. So for example, we know, and Kellyanne just was talking about the fact that hand washing with soap can literally save lives. So part of the private sector soap manufacturing company to bring clean water and soap to a healthcare facility or a market or a school. These are some of the really easy and important things we can do to slow the spread of the virus. I mean, actually, I shouldn't say easy because nothing is easy. Everything is complicated. But a simple intervention like bringing soap and water to a school, market, or care facility can really have a dramatic impact. It also prevents many of the other infectious diseases that cause millions of deaths each year, such as diarrhea, cholera, and typhoid. But this simple practice, hand washing with soap, remains unavailable to more than 3 people around the world who lack even basic clean water and soap, especially in sub-Saharan Africa. Private sector is also another incredibly important partner in the fight against COVID and other infections. So through a new initiative supported by the Conrad Hilton Foundation, we are building capacity for safe water and sanitation by strengthening private sector delivery of latrines and water stations and supporting behavior change for proper hygiene. And there's even a role for social enterprise. Ghana, with support from USAID, global communities worked with Duraplast, which is a Ghanaian plastics manufacturer, to manufacture the Dignaloo, which is a low-cost plastic slab toilet. So this affordable slab is long-lasting, super easy to install, hygienic and durable. It is a pro-poor market-driven solution to address the issue of open defecation and disease prevention, and has already turned a profit in its first year. So to sustain progress, we have already seen and continue to advance safe hygiene and access to water in communities around the world. We have to really be willing to adapt and bring as many partners to the table as possible. Effectively managed water, sanitation, and hygiene services are essential to preventing disease and protecting human health during infectious diseases outbreaks, including COVID. We know that this pandemic has not yet begun to abate and that the next one will probably be right around the corner. Water, sanitation, and hygiene is the foundation of any public health response to communicable diseases. And investments today will ensure that we're really ready when the next crisis hits. So we have to be prepared. Thanks.
Thank you, Carrie. And we certainly agree sustainable solutions are critical to this response. We can't just offer Band-Aid solutions. We need to outlast the virus. And so protecting against new waves and ensuring that communities can access safe wash becomes critical. And I forgot to mention earlier, by the way, thank you for your chairmanship of Interactions Board. Obviously, critically, this is a time and space where we are coming together under that heading, and so very much appreciate your leadership in that space. So I have another question. For both of you. What about the long-term implications of WASH within COVID response? So how can WASH, and let's be as specific as possible, how can WASH programming help with economic recovery from COVID-19? And Kellyanne, I'll turn to you on this one first.
Great. Thank you so much. And I think this is very much, I think the question where we are now, and I think all of us are wondering, how do we move from where we are now to be able to chart out the pathway? I think the first thing is how do we make the linkages with the different drivers of this response? And when I say that we've launched this Hand Hygiene for All initiative, which focuses on what we call the whole of society approach. And I think what we've been trying to do is look at some of these linkages that we've talked about, but we haven't necessarily really capitalized on, particularly in terms of the role that private sector and markets can play. And so one of the things that we've been doing with the World Economic Forum is to try to bring together a number of companies and businesses around the design and manufacture of hand washing facilities. And so these are basically mobile facilities that can be deployed, whether it's in public transportation and workplaces, but enable us to be able to wash our hands at the critical moments when we need to. And these are some new ways that we've been working together to try to do this. I think aside from this component, when we're also looking at some of these issues of scaling up financing. And this, of course, was one of the critical points around the shift between the Millennium Development Goals to the Sustainable Development Goals, was that we would work on trying to make the sector more attractive for financing. And this is one of the things that we're working on in UNICEF, is to try to see how we can attract greater investments for WASH in healthcare facilities, for WASH in schools, and for WASH in communities, particularly in fragile countries, so that we can not only put in place these temporary measures for the emergency response, but also really lift up the whole overall situation of WASH in these settings. And I think one of the things we've been thinking a lot about is maybe the term future proofing, but how do we provide this as an opportunity to not only increase access, but also make sure that it is able to address issues like water scarcity, which is, of course, an increasing global threat. And so that as we go forward on this, we're able to put in place infrastructure and services that will be resilient. Maybe just the last point, and we've been working on trying to project some of these global figures, looking at the economic opportunities and job creation that these increased investments in water, sanitation, and hygiene could bring for local communities and countries to be able to put people back to work doing socially productive work for the water, sanitation, and hygiene sector. So a few ideas, big problem to tackle.
Big problem, a few ideas. Carrie, could you give us your 1 minute, please? I'm just conscious of time.
The reality is that COVID is a job killer and WASH is actually a job creator. When we are able to invest in water and sanitation systems, jobs are created. So WASH should not be just seen as a public health intervention. It can be a driver of economic recovery, and Kellyanne gave some great examples of that. A recent UNESCO World Water Development Report reports or estimates that 3 out of 4 jobs that make up the global workforce are either heavily dependent or moderately dependent on water. So it means that water shortages and problems of access to water and sanitation could limit economic growth and job creation in the coming decades. At the same time, investment in small-scale provide access to water and sanitation in Africa alone could offer an estimated economic return of about $28.4 billion a year, or nearly 5% of domestic product on the continent. And another study in Latin America found that investing $1 billion in expanding the water supply and sanitation network not only would have a huge effect on the health of the population, but would directly result in 100,000 jobs. So the market for jobs in water supply and sanitation is promising, and there is significant potential for growth. And there's also a need for investment into aging and inefficient infrastructure, and that is also a potential driver for employment in the sector. So you can see that investing in water and sanitation not only makes sense as a public health intervention, but it's good for business and economic growth as well. And I just want to say on the final note is how important financing is, and I'm deeply grateful to UNICEF and others for really highlighting both the opportunities for investment, but also the severe need.
Thank you. Thank you, Kellyanne and Carrie, for sharing your thoughts. This has been a particularly useful as the caucus launches during this historic time. And we certainly look forward to future robust discussions alongside the co-chairs and other caucus members. So, I'd like to thank our wonderful panelists, Kellyanne and Carrie, as well as USAID and GAP. Of course, a very special thank you to the co-chairs for their important leadership on this issue. If you are a member of Congress and would like to join the caucus, please contact one of the congressional staff listed on your screen. The work of this caucus elevates WASH, which is critical to saving lives in the current pandemic. And I look forward to future events and conversations around WASH and its key role in unlocking food and nutrition security, economic development, educational access, and enhancing our own national security. Finally, I want to thank DAI, the International Association of Plumbing and Mechanical Officials, Millennium Water Alliance, Global Water 2020, Interaction, and all of the staff that pulled this event together. We look forward to hearing more from the caucus and to future events, hopefully events that one day can be held in person. Thank you again to the co-chairs, and thanks everyone for joining us today. Stay safe and wash your hands.